Today we explore the signs of perimenopause, discuss physical and mental preparation, lifestyle changes, therapies, and breaking the silence around menopause, especially in the South Asian community. Welcome to the Sabrina Show, the ultimate destination for captivating conversations and thought-provoking discussions. I'm your host, Sabrina, and in this episode, I chat with the menopause clinician, Veerpal Sandhu. Please don't forget to like, subscribe, and enable notifications, and share your thoughts in the comments sections below. I hope you enjoyed the episode. Menopause is a natural phase of life and it deserves attention, understanding, and empowerment. Today, I'm super excited because I have the menopause clinician, Veerpal, with me today.
Hi, Sabrina. Hello.
It's so nice to have you here. Welcome to the Sabrina Show. This is a conversation that I've been really excited to have because I'm 37 years old. And as I approach my 40s, I know things like perimenopause, menopause, diet, mental health, these are things that are starting to come up in life for me. And I'm hoping to kind of deep dive into this a little bit more.
Thank you so much for having me today, Sabrina. And I am looking forward to just do this session with you today and have a chat with you today.
Amazing. Let's get started. Before we do, I want the audience to know, tell us a little bit about you and your background.
So my name is Veerpal, and by profession I'm a pharmacist. I have 12-year community pharmacy experience, and as I advanced my knowledge, I then became a mental health expert pharmacist, worked for mental health hospital. And then I always worked around mental health and women's health as I was a pharmacist, and my passion more dwelt into business, into skin and aesthetic, but it all came back to women's health, why there is problems around women's health. I'm owner of Skin and Aesthetic Clinic. I have a clinic at Harley Street where I run my menopause clinic and my skin and aesthetic, and a clinic in Romford. But I also work as an NHS clinician for women's health, especially for menopause and for mental health in women. So that's all work around the mental health, menopause. As we start to age from 35, all the problems comes into the life, and I try to solve them basically either privately or via NHS.
Yeah, absolutely amazing. I am actually really excited, and where I want to start in this conversation is perimenopause. I actually didn't know. I always had, through my mom and my aunties of menopause, but then all of a sudden doing a little bit of research, I realized there's a perimenopause. Talk to us a little bit about what is perimenopause.
So I would like to step back to the hormones first.
Sure.
So the women's hormones start to change as the period starts, so the menstrual cycle starts, and it's with the lifestyle, and the phase is different. Menstrual menopause or perimenopause is no disease. It's not anything we need a treatment. It's just to improve the quality of life. So when girls start the period, some tolerate well, there is no problem at all.
Yeah.
They get on with it. But some girls really have bad periods, or it affects their mental health, or really some women, when they go through period, they're really grumpy, like it's totally different person. And then the fertility start, and then our hormones start to deplete, or ovaries start to work different way, and that's the stage is perimenopause. Perimenopause is just pre-menopause, when the hormones start to fluctuate. And the menopause is when actually the fertility cycle is start to come to end.
Right.
The period when we don't have period for 12 months, after that is the menopause. So before that, any fluctuation in the hormones after the post fertility, or even during the fertility, that is perimenopause. And every woman will go through a different stage. Some will go early, some will go late. For example, if someone went through a chemotherapy, or they had any uterus removed, or any clinical reasons their hormones or perimenopause will start early or later, and saying the menopause cycle will start early or later.
So it varies for women at different ages.
But perimenopause is when the physical symptoms of change actually start.
So what are some signs and symptoms that women should look out for?
So every woman have different symptoms. If, for example, you're 37, I'm 38, you may have started to notice different changes in yourself than I would find. So I try to divide when, for example, I do the mental health clinic. I have women who are booked for mental health clinic in my mental health clinic.
Yeah.
and they say, I'm losing the plot, I'm forgetting, I'm stressed, I got anxiety. And that's what they told the receptionist. So they booked with me for mental health, give me some antidepressants. But then obviously I am a menopause clinician. I like to take the whole history, what they're going through, what the changes is going through. Then I move them to the menopause clinic. And then every woman will have different symptoms. But how we divide the 3 different symptoms is, first, I'd say always, is the mental health is the first symptoms women start. The change is the anxiety, is the agitation, frustration, getting very angry, and low mood and depression. So anxiety is stress, is end of the world. They suddenly start to become very stressed. Even getting 5 minutes late is end of the world. They start to have palpitation, panic attack. That's one. And then it's agitation, frustration. That's why they say she just start to turn bipolar. She having a midlife crisis. The woman will do a murder on anything, basically. Little thing, not anything, little thing. And they say, 1 minute you was happy, what's wrong with you? You're bipolar. That's the comment or compliment the women start to get. They start to forget things. They can't even remember their own children's name or put their keys in the fridge. That's the little changes they start to. And then the third category is they will start to get frustration, agitated for no reason. Like some are reasonable, but some really get frustrated. And the third is low mood and depression. They will start to take a break from the social. They start to compare themselves, and that's when they will not talk to anyone. That's the low mood and depression. And some women may have all 3 mental health, or like brain fog as well, forgetting things, or some may just have, if someone got more anxiety from 5-7 days a week, they suffer more 4 days, they literally having stress. That's when we know they're suffering from anxiety. Same goes for low mood. They're not looking after themselves. They're not talking to themselves. They're crying, emotional, for no reason. They're just crying and frustrated. So that's how we go.
That's a very broad spectrum.
Very broad spectrum
of things.
So, for example, you could be having an anxiety and palpitation, stress, dropping the kids to school, and they just drop something on the floor, and you just go mad. You lose it. Or you just cry for no reason. Just your husband asks you something and you just start crying. Or your kids say something before it wouldn't even bother you. But now you start to see whole world is against you.
So how do we navigate through our mental and mental health? You know, how do we navigate through these changes?
And the first point is acknowledge it.
Right.
When we deny, as a woman, when we deny, because our family member, our children, our husband have started to label us, she's bipolar, she just midlife crisis, we accept it. Oh, it's my age, it's this, oh, it's not that. You acknowledge yourself, hang on a minute, I was not this woman before, so why suddenly I become this? I become a devil, I become this. What is actually going through? And that's when then you're gonna notice, is it, obviously now we're talking about menopause, otherwise you will end up in a depression clinic. So now actually let me see other symptoms, and then you say other symptoms is your physical health. Physical health is your bones hurting, joint pain, lack of energy, you sleepy or you can't sleep, hot flushes, sweating. They are your physical symptoms. They're the main. Obviously, any change in the period. Some women really start to have very heavy or irregular period. We know when women going through change, they need to have a hysterectomy, they need to have medication. That's the physical change.
So these changes that you're discussing, do these happen at the perimenopause stage or at menopause stage?
They all peri.
Menopause. Wow. So this is starting right from the get-go.
Okay. This whole thing, this is all just consider menopause is the main event. No one even know about that. That starts from 45 late when you stop period. Some women don't start, they still have proper regular period till they are 50, 55. But some women may start to fluctuate period from 45 late. So we can't really just label menopause with periods only, because periods is, some women may not have a period. If someone on a contraceptive or a coil, they won't have periods. But other symptoms, so it's always with the symptoms. Even your blood test may not find everything. So you go control, this is your mental health, this is the physical symptoms, the bone pain, lack of energy, any changes you do notice in your period, heavy, lighter as well, and then the weight. That's I'm going to talk about. The physical changes come, your hairs are thinning, your appearance changes, we call your hair thinning, your skin is more loosened, you start to have melasma, hyperpigmentation, some start acne as well, and then obviously body shape change. you even drink water and it's like a cup of oil basically to you. So your body shape, your metabolism reduces, and that's when women lose the confidence. That's why a lot of women do lose the confidence, and they have comparison and FOMO. I don't look pretty anymore. I don't. So that's your appearance changes, and that's why it does affect a woman as much as that's why we say body confidence, but see what's actually affecting quality of your life. So when women, we're going through these 3 symptoms, your appearance, your physical health, your mental health, but what is actually affecting your quality of life, point to that one first. And then you go. But menopause is when your period stopped for 12 months, that's when we say that woman is menopause, and then reproductive cycle has kind of come to an end. But every woman's phase is different. We have 65-year-old women, we still give them HRT and they have periods.
Right.
Yeah.
A lot of what you have said, it seems really, if I'm really honest with you, really dark, really like dismal. It's like, oh my God, all of these changes are going to happen. And that's the reality of the changes of what we go through. And like you said, you have to accept that our bodies are going to go through that level of change. Is there anything that through diet, through mental health, through the awareness of ourselves that we should be doing to prep and prime our bodies and our mental state for that process?
The first and foremost, I always say, is looking after your mental health, and second is your nutrition. So the mental health is, have you got some self-care routine for yourself? Anything, just see what is cognitively affecting your brain health, because women's brain health is linked to their ovaries. When ovaries start to deplete or they start to not that strong, their brain health get affected. That's why they're more emotional and sentimental, and that's the change happen around, and that's why when periods is women's emotional health. So try to do anything self-care. Either it's a spiritual, if fitness gives you that hype of really motivated. Because what happens when we give antidepressants? When I give antidepressant to women, if they do need it, it's not every person would need antidepressant. They are just to balance those hormones in your brain. That's all their job. For example, serotonin, we give the drugs to balance the serotonin in your brain.
Right.
But if you have a good balance, so if you're doing exercise, you're going for a walk, you have some meditation, basically if you navigate your regulate your nervous system, you're generating those hormones anyway. Like dopamine is generating, you're more motivated, you're more happier, serotonin is more relaxed and happy, oxytocin is love and you feel loved yourself. So try to do these few activities. You're looking after mental health. But then the second is nutrition. It's a big difference between nutrition and diet.
Right.
That's when people get confused. I am doing dieting. Dieting is you want to have less calories in your body to lose weight. Nutrition is you can have a burger, you can have McDonald's, whatever you want, but are you having enough nutrition to give you those strength to your body? So make sure you are having the right nutrition. 5 a day is good, the fruit we say, but for women, the nuts, the seeds is very important. Because nuts and seeds have rich, like nice natural pumpkin, sunflower seeds. They release good hormones and they also give bone health as well and the brain health as well and the right nutrition which we need, and they help in metabolism. And when we have right nutrition, we won't feel that hungry. But then it again link back to our mental health. If we really looking after it, we will motivate it. These are the 2 things when you start to do. You look into your fitness as well. It's a lot of lifestyle changes. You're putting yourself first. From 12 hours a day, at least give 10 minutes in the morning, 10 minutes in the evening to yourself. You're really focusing on what actually is affecting, what's changing in me, and what little things I'm going to do to look after myself for those few changes.
A lot of the things that you're saying, I'm sure the audience is going to be like, I don't have time for that. My kids are 5 and 8. I don't have time for myself. What does time for myself mean?
Yes.
How important is it to have a proactive approach, knowing that eventually as women, our bodies are going to go through this natural cycle? So how important is it for me to be proactive at age 37 to say, hey, you know what? Doesn't matter what's happening, how much my kids need me or my husband need, the dishes need to get done, this needs to get food, needs to get cooked. I have to put myself first. Because I really want women to really understand the importance of being proactive and how that this could be so helpful for them later on in life.
So it's non-negotiable.
That's
so
it.
We brush our teeth. No matter what happen, we can't go without brushing. So
I want you to say it in the camera.
Okay.
It's non-negotiable. So the audience hear it loud and clear.
We find excuses. First of all, we do find excuses. I run a business. I work for NHS. I got 9-year-olds and I got 6-year-old, and then I do all the activities. But I was the same. Sometimes I have the days when I ignore myself, but because I have to set an example for my clients, if I haven't experienced it, how I'm going to understand it. So 10 minutes, you don't need the whole day. You don't need an hour exercise, because the approach has to be sustainable. It's a sustainable approach. When you start to give 10 minutes, even 5 minutes to your mental health and 5 to your body, and pre-prep your meal. Just add what is the nutrition you enjoy. I like seeds and nuts, and I mix with a lot of other different things like dates and that. That's my nutrition, and I make sure I have in my body on the go. Pick a fruit or something. When you have in your naughty food, it could be anything, whatever you enjoy, but make sure you have added your nutrition, and then along with it, obviously, then you won't feel that hungry. Even you're going out, just do prepare yourself before.
Yeah.
Same goes to fitness. If you can't do exercise, you have the excuse, I can't do half an hour exercise, but I can chat someone on the phone. I can watch Netflix.
Yeah.
I can sit with my child doing something, but involve the children then. Involve someone with you, find accountability partner, and do tell them, I'm really suffering. I need a help. You need to remind me for 10 minutes. And then same goes for example, your skincare routine or your self-care routine. Give that time. But you need to at least start weekly first.
Yeah.
And slowly, you will increase the time.
Yeah.
It will lead to half an hour, because it will become part of your body then.
Yeah.
And that, but you need to, it's not menopause, you stop your period. It's beyond that as well, and sustainable. And then your family will look you as an example, and we try to teach them good manners. We try to teach everything to them, but it's very important, even if your daughter or son, to teach them is how you put yourself first, self-care and looking after, and that's the proactive approach. And find support system as well. It's a lot of support system around. If you think you're struggling, do ask someone for help as well.
Amazing. In terms of mental preparation, what conversation should people be having with themselves, with others, to ensure that they're adopting a more positive mindset around menopause? Speaking to women in my family, one of the biggest things that they talk about when they're going through menopause is that, first of all, it's like a sudden shock, you know, and they feel like as if their mental health, their mind and their body are at totally different levels. How they're feeling in their head can feel quite dark, and obviously their body, they don't understand what's going on. So before those symptoms sort of kick in, what conversations should we be having to ensure that we've done the mental health prep?
Yes, so preparing for it, as I said before, acknowledgement yourself. Because you check your body, scan your body, what is actually different going in your body as well. Once you acknowledge yourself, actually, I think I am going through the change. Something is changing me. It could not be menopause. It could be another clinical reason. It could be thyroid. But you acknowledge yourself. You do talk to your family. I feel like I'm having a brain fog. I'm forgetting things. Or have you noticed I've been more emotional lately, or I've been this? That's your family will feedback you. Actually, I have noticed it. And once you prepare yourself, then you see what is actually before even the symptoms start, or not anything which is affecting your quality of life. Because menopause is not any disease or anything we have to treat. This is part of the change in our human body, which the woman's body go through. But as long as your quality of life doesn't get affected by it, that is the aim. You ask for the help by different resources. Either you do yourself lifestyle changes, you go to change nutrition, diet. If it's mental health, how are you going to do different things? You're doing things differently than you was doing before. So actually you're more happier, you look confident yourself, and you're more fitter as well yourself, and you have more energy, and you can do the same things before you was doing, rather than saying, I don't have energy, I can't do. And you start to feel old yourself. It's not like you look old, it's how you feel yourself. Once you acknowledge that, and try to, if we are talking about menopause, and see which effect is more mental health is affecting, or is it physical, any changes you see, and then research it, find the information and then ask for support. Either it's your GP or your friends and family, any resources you find as well.
Yeah.
And then do involve, talk to your, when you're having your meals and that, openly talk in the family.
Yeah.
Because any change we start, awareness, it should be starting from home.
Right.
Like it was Men's International Day yesterday.
Yeah.
In my husband never, it's not like he don't talk about mental health, but it was like, nothing mental health. But I can see it since I've been more into mental health. My husband shared on his reels of WhatsApp about men's mental health yesterday, and I was quite surprised, not shocked, but it was because I'm talking more about awareness starting from home.
Yeah.
Like men should cry, and the same is women. It's such a taboo subject. We have made it. The women, when they're having a cup of tea or meals, or they're going out with their daughters, with their mother-in-laws or your moms, have an open talk, and then you will learn, actually, oh, she's going through this.
Yeah.
What's her symptoms, and mine are different.
Yeah.
And that's when you can relate some symptoms, but some would be different. And that's when once you acknowledge, then you know how you can support others and how you can help. And you will learn when you have conversation.
Yeah. And I think it's about having that open dialogue. When you are having this open dialogue at home and you're in a comfortable environment, then what you're talking about feels really comfortable, and you're able to open up a lot more.
Yes.
And then you can then take that onto the outside world and share that with other women. And like you said, 9 out of 10 times when you're having these conversations with women, they're probably feeling the same way.
Exactly.
I know when I'm having conversations about something, that could feel quite raw and it make you feel quite vulnerable. When I have that conversation, my friend is like, oh my God, I'm going through that as well. Everyone's going through, because going back to the very beginning, it's a natural phase of life.
It's a natural phase. Like when we having babies, we openly talk about, oh, I'm feeling this. And as soon as they say going to have a baby, we tell them all the advice, do this, do this, do this, do for this baby. But when it comes to this, we don't talk. I don't know why we don't talk. When the woman is pregnant, mother-in-law, everyone, friends, family, give every advice on that. But why there is no advice for menopause or perimenopause?
Yeah.
That is so. We need to, maybe previous generations not talk that much, but we need to openly talk, and do talk to your sons, to your husbands, and everyone. My boys now know what menopause is like. Suddenly they will say menopause. Yeah. But I know, because the change has to start from home. It's not change, but awareness has to start from home. Yeah. And then at least your family in your house and surrounding people know about it. If you work in an office, talk to your colleague. Yeah. Do a little tip, something about this. You don't need experts and expert. Person who going through the symptoms is the expert herself. Yeah. We maybe have done books, research and everything, but what person have gone through it, they would have the most experience than anyone qualified expert. Yeah, that's how it should be. And when that change start, then everything will fall in place and people will support you, and you can support others as well.
I have some really exciting news. Being a small business owner myself, I'm always looking for ways to taking my business to the next level. It's really important for me that I'm showcasing my brand, products or services in a way that really talks to my ideal client. We're offering a variety of sponsorship packages that will help you do exactly that. Could your next client be watching the show? Your brand will be showcased to our engaged audience right in the middle of their favorite show. From shout outs to full-on dedicated segments, we have a package that will suit your brand's needs. Reach out today and let's make your brand the star of the show. Drop us an email to find out more. I find it quite interesting actually. Why is menopause such a taboo subject? Because even just listening to you talk and thinking about, I don't think I've actually ever heard my mom or my aunties actually openly, they'll talk about the symptoms that they're going through. Oh, I had a flush today, or my body's feeling like, but they'll never sit down and say, oh, this is what menopause is all about, and try to speak about it end to end. Why do we have a certain stigma attached to menopause?
Because it was labeled. So I had to do a talk in Gurdwara to our community. And I thought, I really want to find what is the Punjabi own meaning of menopause. And I spoke to my nanny. My nanny is 98-year-old, but she's quite good. I found her. And then she said, I don't know what it is. And the way she said in Punjabi, it was that when a woman give birth, even you have a child or no, when a woman start to get age, she get labeled as a different woman. And they start to believe it. I am a different woman. Basically, I'm getting old. I'm gone crazy and my body is changing. I start to look ugly because that's people label. It's not herself. She's not looking that pretty and she accepts it. And then everything else just brushed under the carpet. She get on with her life, and then the children, if they have children or not, and then that's it. She's labeled as old woman from 40. That's what has happened in the past. And from 40 start, she labeled as old woman, and then it goes, and then she start elderly.
And that really affects you because you start to feel worthless.
Yes,
and you start to feel
that's
like
the right word as well.
Yeah, and you start to feel like, oh, I'm not able to contribute. You know, I can't contribute anything. And a lot of women feel like they've lost themselves along the way. And then you're all of a sudden, you know, you're not even allowed to re-find yourself. You're supposed to just accept that, okay, this is the position that I'm in. And even the people around you, the community, even your own family members accept, oh, this is the position that you are now in. And I feel like that really needs to stop.
It needs to stop. And it's all women need to control it, not someone else. If she's going through a symptom, she is going through, and she's going to find a way to overcome it. And help is only the woman can help herself. Nobody can help her. Others can support. Others can't help her, but the woman herself need to help herself. But everyone around her, either is her daughters, family, friends, any other experts, they can support her around it. But she need to help herself, and to help herself, she need to take control. If she's going through anxiety or that, she is going through it. That's her symptoms in her body, and she know how she's gonna get help. But someone can't call her crazy. Someone can't. But that's what been happening in the past. That's what. But it's changing, but it need to change more. When it's coming to menopause, it's still. We still don't talk that much. Like, we're not accepting it. I am going through change. Going through change is not a label of getting old. And we need to really address it. Going through menopause or perimenopause symptoms is a sign of aging. It's just a sign of your hormones are changing, and you really need to. It's a new chapter. It's really, you've done everything for us, for your family, everyone. This is for yourself, the new chapter. How are you going to take control of your health and your well-being and just smash it, basically?
And that's it. And I feel like it's really important to have these conversations and to encourage people to not only listen to these conversations, but have the conversations yourself with loved ones or people that are potentially going through the menopause themselves. Another thing that I really want to hone in on and spend some time talking about is therapies for menopause. I know that there's things like hormone replacement therapies, there's alternative therapies that are available. Talk us about the steps. So if someone's feeling like, you know, they may come to you, to your clinic, or they might go to their GP, what is the process of getting help when it comes to therapies with menopause?
So what happens? Obviously, before there was no talk about menopause. No one went to their GP. Oh, I'm going through a menopause. But now we're getting a lot of calls. So the receptionist, the woman will phone. Either she will say, I got anxiety, depression, to the receptionist, because they take a control of it. And then they will book to either mental health clinic, or now women know, I think I have a lot of symptoms. I want to speak to clinician or doctor. I got menopause. And then when they get booked. So first of all, women have, that's good, well done to her. She acknowledges something is changing in her body. Is symptoms, either mental health or physical health. And she's thinking, I may be going through menopause. And then they booked with us. So when a patient is booked with me, and then I know I need to go through, not necessary, they will ask first of blood test. And the reason we always need the blood test, because it's either is affecting their mental health, they gain the weight, they're not themselves, they're having hot or cold flushes as well, they're feeling tired. It could be anemia, it could be vitamin D deficiency, it could be their liver or kidney functions got affected, it could be they're going through thyroid mimic exactly the same symptoms as menopause. So 32-year, 35, 40-year-old may be going through thyroid. That's very important. we have the blood test first
Yeah.
to rule out any other clinical changes going through the body. So once we've done that, okay, if the person is anemic, we know we need to sort out. If they go vitamin D deficiency, we need to sort out. Everything gets sorted. They could have a raised cholesterol. That's why metabolism is affected as well. They're gaining weight. So we need to sort out their diet, what they're eating as well, diabetic as well. So everything goes sorted.
Yeah.
I always ask every single symptom. So then I again divide into 3 sections: the mental health, the physical health, and any metabolism, weight again, BMI we check, blood pressure, heart rate we check.
Yeah, so you really deep dive into the person.
Down.
Yeah.
My consultations are always 20 minutes, or if a person is already on HRT, 20 minutes. If it's a new menopause woman, it's 30 minutes, because that's how we can really go through it. And then once we're done, then we have to make sure what is affecting their quality of life, because everything else is part of life, is part of the plate. Same symptoms sometimes we have in pregnancy anyway.
Right.
But actually they need to improve in next 6 to 8 months. If it's a really anxiety and palpitation. So HRT, if I'm giving to some woman HRT, if they say it's a lack of energy, and it's a mix of, they have little bit of lack of energy, joint pain, they go hot flushy sweating, and it's affecting their sleep, and they have anxiety from 7 days. They're feeling around 3 days anxiety, but under the surface, not over the surface. It's not panic attack, but they worry too much. Then we know, and then we see if their BMI is raised or something, what we need to work on, lifestyle advice. And then I always give the option to women. If some women come prepared, I'm going through perimenopause, I really need to sort it out. GPs don't have a magic wand. We need to accept and acknowledge the patient. Okay, you're going through a change. We are there to support, and we guide them. Okay, your BMI is raised. We need to work on your weight, everything others. And then if the patient say, I want HRT, that's the only thing GP actually physically can give a prescription.
Okay.
So we give a HRT. Not every HRT will suit every patient. It's not suitable for everyone.
So it's different variations?
It's different variations.
Okay.
Not everyone can clinically have HRT either.
Okay.
If we need to look on their cancer treatment they have, cardiac issues they have, breast cancer they had, they go uterus or it's been removed. So all these things, any fertility issues, because even if they not had a child, but they can have a child up to 50 because they still go period. So we need to look all those aspects. Are they not trying to conceive as well at the same time? So all these concepts, and then we discuss. The HRT comes in different form, the gels, the sprays, the patches, the tablet, and
you find what
was the right clinically for that
particular patient.
If they go uterus or no. So then we decide. I discuss with the patient. This is we will start, and it's not the one-off. Is permanent. Give a lead to the patient. We will start it, and we review in 6 to 8 weeks with a follow-up. If a little bit improve the symptoms, the patient feel really better, no side effects. Then we can increase the dose. If patients say, I'm a totally different person now, I feel happy, I want to stay on it, that's fine.
Right. But it's good to know, actually. It's good that you're educating us, because I thought HRT was just one pill and you take it and it just sorts you out.
Different.
But to know that it actually comes in different forms and different variations, and it's a little bit of trial and error.
Trial and error with everyone.
With everyone, and everyone is going to respond to it differently. That's really good to know. I know that there's some alternative remedies out there, and I know that recently in the news there was talking therapy coming up, and I know there's a little bit of a misconception around that. Can you talk us more about
so that? If the woman can't have HRT, or that she don't want to have it, but she still need a help, she have every right to have the help, because that's about her health, and that's why NHS or private person is there. So then we look at the symptoms first. So mental health, as I said, is get affected very quickly. We always been giving the talking therapy CBT, but it's unfortunately NHS don't have that many appointments.
Right.
So it's not that if women HRT is like physical symptoms, the hot flushy sleep, we get change. It will improve the mental health as well, because that's the how estrogen levels are affecting it. But person can have along with HRT or without HRT. Either is the clinical decision, is the safety of HRT, or person don't want to have HRT. Then we can talk about the mental health. And the mental health, person just don't want to have any medication around the mental health. They don't want to have HRT. They don't want to have any mental health medication. Then is the talking therapy. Talking therapy is like a counseling, they have talking, and then what is affecting. Some people really need proper therapy because they may have a traumatic life, they may have a traumatic pregnancy, or their periods, when they were having periods, it did affect their mental health.
Right.
Because not everyone get. And then CBT is another which NHS offer, is proper counselling session, is cognitive behaviour therapy which is offered. And I think when it did announce last week, NICE guidelines said we are doing it, but we always been doing it, but it's just get brushed under the carpet because there is not too many appointments. So we got 2 patients coming, one going through the menopause, one actually had trauma or PTSD or mental health. And the person who will be pushed for CBT, he would be the person who went to trauma, PTSD for CBT therapy appointment first, then the menopause woman.
Just because there's a lack?
It's a lack.
Okay.
So that's a lack. It's not availability. And that's why people are more going for private therapies now.
Yeah.
But it does help the woman. CBT really, really help the woman if she clinically can't have, because medication is just to improve the symptoms, just to really improve. It's not something disease is going to clear it.
Yeah.
But then therapy really help, because it could be something when women going through the change, actually, as you said, the worthless.
Yeah.
Something maybe it in her brain all the time when she was a young woman, then she was busy, and now she started to fall worthless and no one listening to her. And when she having the therapy, someone actually listening to her, and she actually put her point across, because that's what therapy helps. And that's the sport she only needed. She don't need any other sport. She only need that therapy sport.
And I feel like that's many women struggle. We don't feel like we're being listened to. We don't feel like we're being heard.
Or we get judged, or we're gonna get judged, so we don't talk.
And we don't talk. And then if we're not having these conversations at home, or if we don't have anyone that could have a support system around us, and no one's talking to us, that's when we kind of close our voices even more. And then I guess when you go through the menopause and your hormones are fluctuating, all of what you're already feeling is heightened.
It's heightened. And that's when they think they don't listen, they get emotional and they cry, or they get frustrated and argumentative.
Yeah.
I had a client, private client come, she had to actually leave her job because she felt like she wasn't listened at work. And everyone, there was young people at the work, and then the environment wasn't, and every time tried to put her voice across. She was very good in her job before, and she felt like she was pushed back because either she was agitated or frustrated or anxiety or worrying too much, or she was emotional. And then at the end she said, I had to have a break from work, and now we obviously started what I need to do with her. But then she said, no one was like, I can't speak to anyone, no one was listening to me at home, or it's just people say, it's something in your head, you just going crazy. And that's what she was labeled for. And that's what the talking therapy will help. Women can actually to talk someone without judgment, and it really, really helped the woman actually. Is there, I know in our South Asian community, a lot of women turn to holistic or herbal remedies. Is there, what would you say around that, or is there anything that you would recommend? So herbal, I'm a pharmacist, we make drugs, but I always say any drug you take in women, we gain HRT, antidepressant, even if it's a diabetes or any, 20% is the only medication works, 20% because it's just to improve your symptoms. But 80% is your lifestyle. 80% is your lifestyle. You can come off any drug, even insulin of your diabetes, if you work on your lifestyle for 80%. And then rest 20% is to just keep your quality of life on the bay. And same goes for menopause. They are just to improve. If you rather have, I will give to my client HRT, if they're really affecting their sleep and mental health and it's going to deteriorate their life, or cause more, like with stress, they can have cardiac issues. So that's, I will make sure they
have. Is HRT like a last resort?
No. Some women prefer to have it. They just want, give me anything. I want to feel it, same woman again. And then sometimes, when we issue repeat prescription, we haven't reviewed, and you try to take the HRT from them. It's like someone stolen their diamond necklace. For the woman it works, and they have confidence into it. It's like someone, they say, you take my HRT away, I'm coming right to your surgery to get my prescription. This is what it's, because it's really improving quality of life. But I wouldn't say it's person to person. Everyone is different.
So how long is someone on the medication for?
Until they ready to come off. Some women do try to come off, and they do come off. By the time actually they have made a sustainable approach, they learned their lesson, or they start to work on their lifestyle. So coming back to the point, they have a healthy lifestyle, holistic approach. They start to go for a walk, fitness, meditation, any healing maybe they needed as well, just for, because if we go blood and flesh, we need healing, we need meditation, we are going to suffer from mental health. Either something happened traumatic in our life or not, because that's our brain cells are absorbing from around. It could be just we absorb from news something and it trigger us. So some women really go for a holistic approach, and it works wonder for them. They do really change. So as you said, any ailments or any herbal things, as long herbal things, that's how the drugs are made from. All the drugs, synthetic version, came from the natural herbs. That's what it is, regardless. Even codeine made from natural poppy plant. But is it from the right source? Like a lot of women, I can give one example. I'm not saying I used it or I recommend. Like ashwagandha, a lot of my clients, can I have ashwagandha? And ashwagandha does work, but it really need to know why you're taking, where the resource come in it, because we can't.
You need to do the education around it.
And we can't find the right product because everything is mixed. We don't know.
You can't go to the true essence of things, isn't it?
Is it actually right herbal medication, or is it someone selling online? We don't know what's the ingredient into it, and it can really have negative effect on your health. But I always say 80% try to change what you can. But as we are busy, we got children, we got business, so we really need to say, if I need to keep going quality of my life, what little things I can change in my lifestyle, and where I need the additional support. Either it's a medicated, either it's expert, either it's a therapy, what other support I need to make really most of it. And I want to be just happier and healthier myself. That's your aim should be.
Okay. We've mentioned it previously, but it's something that I feel like we should kind of deep dive into a little bit more. But there seems to be a massive stigma about talking about menopause, especially in the South Asian community. What level of support should we be giving women, especially within families, within our society, within our places of worship? Should we be giving women? How can we open ourselves up to having these conversations?
Yes, so I do love talk in different, like I just had a talk in one Gurdwara just for our community to talk about this topic, and where we can really, and I was so surprised, and some were shocking questions as well. It just indicates we don't talk enough. And why we don't talk? Because from generation, like now it's changing. Before, if we go back to the periods, no one will talk openly about it. It's anything to do with the women's health is a hidden topic. No one will talk. Everything needs to be hidden openly. We forget about talking with men in the family. Is talking between the women is always hidden. So that's first of all we need to acknowledge and change. It is changing a lot, but it needs to change more. And creating the awareness, having the women in the family is when you are talking to women in the family, do check on them. If, for example, your mother-in-law is snappy, your mum is snappy, or anyone around women is changing, try to dig deeper what actually is going on. And that's just talking about the symptoms between each other. It's not taboo. It's just women's health. Everyone going through the change, how we can support it. And what's happening in our community, because it's a taboo subject now, we acknowledge, we're talking about it, having more awareness around it. Like, as I said, we just did one workshop in Gurdwara, and we will be doing more workshops. And I have got a lot of South Asian clients, and everyone's symptoms are different. It's all about, then once you're talking, asking for the right support. And I can say it's a lot of resistance in our community.
Why?
Don't know. One is our lifestyle is different. We don't prioritize our health, especially the women. In South Asian community, we can do everything for the family, but we don't prioritize our own health. For some reason, we do get labeled with different things. She's getting old, as I said, worthless. If women don't work or anything, we let others take decision for us. So that need to change. It's a lot of other things need to change. Then we need to come back to the menopause. And when I say in menopause is resistance, like I was speaking to one of the clients, and as soon as you said about HRT, it's not even I was going to say anything. No, I don't want to have HRT. So and so had HRT, they had breast cancer. We know clinically there is no link between directly breast cancer from HRT it can cause, because that would not cause, but it's a resistance because they have misinformation. We really need to educate the women around us what is actually right, what is the wrong information, what is the misinformation. And even, for example, we talk about healing and all these, it wasn't before women doing, but now women are more open to it. If someone is doing it, was all secretly, everyone try to create a network, a sport network, even menopause network, and talk to the woman. And if you need a sport, then you ask someone to come and support you. It could be for mental health, it could be for fitness, it could be for, if really, for example, South Asian community, we really struggle with the food. We end up just weight and other disease problems. So then ask whoever is leading in your community or in the family, can't we just have something on just nutrition and diet? Someone can really support us around. And then when it's a medical help is needed, just see what is actually right for you, and then where you need the medical help. We have that sort of thing, nobody can help me now. That's another resistance. No, it's fine, nobody can help me now. People, as I said, nobody can help you actually. You can only help yourself, but ask for a support. If one is not supporting, go for the other support, ask for other. But don't feel yourself worthless or nobody, oh, that's it, it's end now. It's nothing going to happen.
And breaking down that conditioning of I can do everything. I have to handle everything by myself. There's no one here to support me.
No,
you have to make that mindset shift. And be open to the fact that, you do need some support, and that's okay.
Yeah, and we are not always made for serving.
No, we're not.
We're serving to children, husbands, parents, in-laws. Even society is like a judgmental. We need to be speaking that particular way or serving way as well. We don't need to be serving. And it, in South Asian community, it does, because even I'm a clinician, and I can see sometimes change in me. We are made to be given, not to be receiver. So we need to be taking from other people. If you need a good energy and motivation to talk, ask someone to talk to you. If you want someone to listen to you, just put your foot down. You need to listen to me. They all gonna survive without you, but you can't survive your own body, and you really need to look after yourself.
Definitely. I think it's great that in places of worship that this conversation is happening. Can you recommend any books or podcasts or clinics that people can go to seek more advice?
So it's a lot of books around. Okay. Every is different topic. By Dr. Nigat, The Knowledge is really good book, but it's all about the women's health. There is a couple of other books I can add on your YouTube link as well. I will send you, and you can add on your YouTube link. There is a couple of good podcasts as well. And it's not everyone use the social media. Because if we talk about, not everyone do go on social media, and as much as we say social media is good, but social media it can be distracting and misinformation, because you don't know who you're getting the information from. As for me.
So it's really important that people do their own level of research. And really deep dive into themselves and really figure out what area in your life is really struggling, and ensure that you're working on that first. Then you reach out to for help. NHS, it could be to your GP, it could be for a clinician like yourself. It could be, listening to podcasts or reading books to educate yourself further. But I think one of the biggest things is educating yourself further. You can see what is out there that you can take, that's going to help you and enable you better. I will be putting that out. It'll be all in the comment sections below. Any help that's available, I'll make sure it's there. In this very natural phase of life, it's so important to prioritize your own mental health and well-being, and to check in with yourself and having this conversation with yourself. I already starting to put the steps in my head of the things that I need to do now in order to prepare myself, so that when I go through this phase of life, it's not such a shock to the system. So thank you so much for joining me today on the Sabrina Show, sharing all your knowledge. I'm going to ensure that whatever we speak about after this, and the links and whatnot, that they're all there, so people know that there is a wealth of knowledge and education that they can access to ensure that they get the help that they need. But thank you so much for joining me. And it was a pleasure learning so much from you today.
No, thank you so much for having me. And I hope even one person gain one step from it, and it will change their life and they will learn. But as I will be following you all the links as well, so people learn more. But we need to do more, talk more about it.
Yes.
That's what we need to do. But thank you so much for having me.
No worries.
Thank you.
Please remember the content discussed in this episode is for information purposes only. It's always important to seek medical advice from your GP or health professionals.